So our group had a traumatic brain injury, specifically in the pediatric population. Okay, so to begin with, what is a pediatric TBI? Pediatric TBI is any trauma to the head that damages the typical brain function of the child. It's generally chronic in children due to their developing brain, and the damage may not be immediately visible. The TBI may has different severity rankings that could be mild to severe. The mild ranking could be uncomplicated or complicated, and some characteristics of a mild TBI are loss of consciousness for less than 30 minutes. The Glasgow Coma Scale of a 13 to 15 score. The moderate TBI could be a loss of consciousness for 1 to 24 hours, and the Glasgow Coma Scale of 9 to 12. And the severe TBI could be loss of consciousness for more than 24 hours, and the Glasgow Coma Scale of 3 to 8. So the Glasgow Coma Scale is a quick assessment that identifies the severity of the head injury discussed on the previous slide. Any medical professional can administer the GSC, first responders, EMS, nurses, doctors. It's scored based on the patient eye-opening, verbal response, and motor response. The more points awarded indicate a less severe head injury.
A leading cause of death in children ages 0 to 4 is traumatic brain injury due to falls and assault. The secondary cause in children ages 0 to 4 are car and bicycle accidents and sports injuries. However, these are much more common in older children. This is a chart that lists characteristics and causes by age group. In the U.S., nearly 500,000 children are admitted to the emergency department each year due to traumatic brain injury. Boys ages 0 to 9 are more likely to be subjected to TBI, and the most common type of TBI is an mTBI, or more likely known as a concussion.
Symptoms of TBI vary on age of the child, the severity of the accident, and any pre-existing factors, but some general symptoms that are common include physical symptoms like seizures, impaired movement, or change in level of consciousness. There can also be vestibular or auditory deficits like vertigo, hearing loss, and tinnitus, as well as visual changes in perception, vision, and sensitivity to light, and then cognition changes such as attention span, lack of judgment, and decision making. In younger children, you may see changes in eating, also the same sensitivity to light and sound, loss of language that has been acquired in the past, as well as changes in sleeping and play. Symptoms that are specific to speech and language include pragmatic deficits, which are largely affected by TBI. This can include identifying emotions, interpersonal effectiveness, as well as the presence of aggressive and challenging behaviors. This is so because of the brain that is still developing in a child. The TBI can have a great effect on this kind of thing. Other things that can be affected are cognitive impairments such as executive functioning, like attention and working memory, as well as spoken language and speech, such as fluency and hypernasality. This chart outlines several communication problems that can arise from moderate to severe TBI in children and adolescents, basically what we just talked about in the previous slide. There can also be feeding and swallowing deficits. Generally, this is present in children that have had longer ventilation periods and a more severe TBI. So this can be a result of brainstem injury, anoxal injury, as well as subdural hemorrhages and secondary mechanisms. So this could be any type of effect on feeding ability, inability to swallow, or changes in diet due to the injury. Therapy focuses for children with TBI can vary greatly depending on the severity of the injury, age of the child, etc., so they are extremely individualized. However, the main long-term goal for most children is to maximize their functional independence and developmental age-appropriate activities of daily living. So basically, the therapist is trying to use alternative strategies to compensate for any deficits that they have gained from the injury and minimize any complications to maximize their potential and their ability to have a normal life.
So one therapy approach that we focused on is the family-centered practice. The research article developing a family-centered care model for critical care after pediatric TBI explored the family experience of critical care after the pediatric TBI. It uses qualitative methods with semi-structured interviews with the parents and 2 level 1 trauma centers. The results of this study identified 3 themes of the family-centered practice. They are effective communication, capacity building for the family and providers, and coordination of care. However, we're going to focus mostly on effective communication because that one pertains to speech therapy the most. The study discovered 5 factors that were associated with effective communication in acute care settings. These 5 factors are thoroughness, the use of multiple methods to ensure understanding of TBI and patient care with the parents, timeliness of the communication, so timeliness of relaying the information about the patient to the parents, listening to the parents, and preparation for decisions and outcomes. The study, so through the outcomes listed above, the parents of the children with TBI reported that these strategies listed above decreased anxiety and distress and it made the parents feel included in the care for their child by being informed in timely manners. And the parents also reported that they felt empathy and respect for their family from the providers when the communication strategies were used. This chart basically outlines the 3 themes that the study found and the factors that they found underneath each theme.
The restorative approach is one of the approaches that can be used in therapy. It's simply bringing back skills that the child once had through drilling exercises and retraining the brain. You will see this demonstrated in our video. We use this technique to reteach pointing and joint attention. The habilitative technique is used with the pediatric population because it focuses on teaching skills that have not yet been developed. So an example of the habilitative approach is teaching the use of figurative language. Figurative language is a later developing skill, approximately 8 years old, so we would not expect to see this in younger children. And the compensatory approach is simply finding a new way to complete a task. An example would be using PECs to communicate wants and needs after a severe TBI where speech and language skills are lost. In the video, we demonstrate using the restorative approach with 6-year-old Carla. Her mom is concerned with her attention skills and focusing on objects when interacting with family members. So we reteach pointing. Some concerns about her attention. Well, we're going to be working on that today with a shared book reading activity. And we're going to be using a pointing technique using the hand over hand prompt. You just simply take her hand and point to the different objects on the page. Today is Thanksgiving. What do we see on the page here? Do we see a turkey? Turkey. And a dog? And a football. Awesome. Today is Thanksgiving and an icicle breeze nips at your window and whips up the leaves. Let's look at the leaves. Boy. Girl. Leaves. Look at the leaves. Ah, what a morning! The cold autumn haze brings visions of pilgrims and Indians and maize. Pilgrims and Indians. They're carrying maize and chicken. Would you like to try?
Yes.
So wrap in a blanket and don your warm socks and pretend you're descending on Old Plymouth Rock. And with football in tow, downstairs you go. What do we see here, Carla? We have a football and a boy and a girl. Flowers. And flowers, Carla. Already the kitchen's beginning to swell with all the aromas you know so well. What do we see in this picture? We have apples and pie and leaves again. And boy and girl.
Great job. Okay, so just remember when you're practicing this that you should position yourself so that she has the least amount of distractions in her line of sight. So in like the corner of your room or just anywhere where she doesn't have a lot of things going on around her.
Okay.
That'll work on her joint attention.
So how often do you think I should be doing this?
Yeah, so we are doing the restorative technique. This is a common technique used for TBI patients. So the restorative technique, one of them, the components is drilling. So what we're working on is getting a lot of repetitions of working on her pointing. So you want to work on pointing as often as you can throughout the day. What is the best time to do this activity at home?
We do read a lot together. We have this time in the afternoon where we read books. So
Great.
That would be a good time.
Absolutely. So just do this activity when you're reading with her and then practice pointing as often as you can.
Okay, great.
Here are some handouts on pediatric TBI and the effects that it has on your child and how to help you better understand her condition. So if you have any questions, feel free to let me know and I'll help you as much as I can.
Awesome. Thank you very much.
You're welcome. Have a good day. Bye, Carla. It was nice to meet you.
Bye.
Okay, so communication outcomes depend greatly on the severity of the TBI. However, many children with TBI will continue to exhibit deficits in attention, speed of thinking, verbal and visual memory, as well as many executive functionings such as control of thoughts and feelings and behavior well into adulthood. So they may need additional supports and therapy as they continue to grow in age. Lastly, we have 3 parent-teacher resources here to aid with any information that you may have. The first one is a document that outlines different approaches to therapy, different causes of TBI, as well as information about the recovery process, and then different strategies that we talked about in our presentation, just more in depth in parent-friendly lingo. So this is really informative for the parent or teacher. Next, we have a resource of more resources. This page has more specific links to different sources, such as head injury, different Q&As about TBI. This is really anything you could ever want. So this is a great source for people who are looking for more specific information. Lastly, we just want to talk about the Traumatic Brain Injury Resource Center in Sylvania, Ohio. They will be starting a pediatric program in the spring, so that's really cool. If you know anyone or want to get involved in that, this is a great local resource. They provide different therapy, also a support group, and just a place to get information as well. Here are the rest of our resources that we cited within the presentation. So thank you for watching our presentation.